So where are we? This location, any idea? Huh? Foot? Is this foot? When you call this is leg? No, andek mo. Huh? This is a river. So at least he's not saying a foot, then he will be saying laces. Water under the bridge, so you're talking about uterine artery and ureter. But do you know this location? Any idea?
Somewhere in Europe.
Somewhere, somewhere in the world.
Pakistan.
No. No. This bridge is called Lover's Bridge. Thank you. So many people, when they get married for their honeymoon, they prefer to come to this place. And Kuwaitis are coming here a lot. This bridge is located in a city called Aydar in north of Turkey. And why I'm bringing this bridge here? What it has to do with the foot?
The arch.
The arch, thank you. And you know, if you look at this bridge, it is not made by any concrete. It is just made by stones. They plug stones together and they create this arch. Now, how it is possible that we can put the stones and they are not, why this arch is quite high and why it's not falling? Can you do it? I can give you this many stones and try to show me, even a small one. There's a trick for it. It's not only. So this is the live place. People are going, walking above it. And can you see the height is so low? The height is so low, even those who are standing here, they might fall down. Because it's maybe not 10 inches. It's smaller than it because they have to minimize the weight over this bridge. And this is a very old, I don't know which century it was made. It's not new. So anyway, let's proceed with our topic. Now we'll talk about foot. So I know you're not wearing your glasses, that's why. So today's topic is the plantar arches of the foot. And I have painted a foot for you. What does it signify here, this foot? Do you see on your foot, under surface, such color?
No.
This is the areas that go on the ground.
Huh?
Yeah.
When you step, the area that's colored is the one that goes on the ground.
For testing our foot, is normal or abnormal? We take a piece of paper, we put a paint on that, and then you're asked to put your foot, or just put your foot in a small container of paint, and then step on a white paint. If you see this pattern, it has a different name, but if you see everything, everywhere is the paint, that is an abnormal foot. And this is a normal foot. So only this much part of the foot is touching the surface with your full body weight. Now, as our learning is going through the bones of the foot, that's important, and we'll talk about it shortly. But primarily, you're looking at the medial view of the foot. And this is how you can construct. If you want to make a foot, you can use this box pattern. It's just a sketchy thing. So let's come to our business. You're looking at a foot from the top. And let's label it. This big bone, which makes our heel, we call it calcaneus. And then this bone, which is quite high up, that is talus. right? And then it fits in the two melodi of which bone? Tibia and fibula. And the highest point of this bone has a name, right?
Hinge.
So that is
Hinge.
no, not hinge. It's not trochlea. It's basically form a base. We call it mortise. Highest point in your foot. And if you pay attention, it's wide in front and narrow at the back. Right? Just forget it, this sinus. Now this bone, on which side? On the medial side. Next to talus. This bone is navicular. And this one, onto my fifth digit, onto the lateral side, we call it cuboid. It looks like a cube. And these three are cuneiforms. And these cuneiforms are medial, intermediate, and lateral. Are you good?
Yes.
So these 7 bones contribute in making the tarsal bones. Are we clear? After this, we have metatarsals, and then we had phalanges. Like my upper limb, like my hand, my first digit has only 2 phalanx, and the remaining ones have 3 phalanges. Are we clear? Any doubt here? So this joint, this is a joint between talus and calcaneus, and then in front we have navicular and cuboid. This joint we call it mid-tarsal joint. It is going transverse, so we also call it transverse tarsal joint. And then the joint between my cuboid and cuneiforms, and in front they are meeting the metatarsals. So this number 2 is tarso-metatarsal joint. And this joint here, metatarsophalangeal joint, and this is interphalangeal joint. Are we clear? So we number the toes from 1 till 5. I hope by now you have learned pre-axial and post-axial. Did you ask, Paul? Then will you wait for another century? Now, you are looking at a foot from both the sides. This is from the top, and this is upside down. Now coming back to that bridge, and what is the philosophy? Why this arch is maintained? The stones are not flat. The stones are wedge shape, and this is how they fix in each other. And this is not only this bridge. Go anywhere, small towns and small countryside, the rural areas, you'll see the villagers, they make the bridge on this concept. And the small cars can go above this bridge and it will never collapse. And if you see the graves, like here people use slabs, but in villages people still use the stones. And how these stones are placed, they cover this where a human is underneath and they don't collapse. They place these stones or bricks in such a way that it will never fall. So this concept is used a lot of time, a lot of areas. So now let's see how we can construct a bridge. If you understand this, you understand the whole story. And number 1, why we need a bridge?
Support. Support the body weight.
Why we need a bridge?
Just to facilitate movement. To distribute weight.
You know, if it is flat, it is more stable.
Things can go forward.
Anything goes under our feet. You are standing and some animal is going underneath.
Helps us in running.
Huh?
Helps us in movement.
Before you said right, then you twisted on your question. Say what you said first.
It helps us in running.
It helps us running. It helps us jumping. Arched, you know, in your car, if there is no suspension, drive that car from Riyadh to Majma, you'll be dead. You'll be literally, you'll be stuck. Every jump will not be a jump for you, it will hit your body. But your car has some suspensions, and these suspensions, they absorb all kind of shocks. So our foot is designed in this way so that it should absorb the shocks. And an arch has to be created. If I have to create an arch, I need a base here and a base here. How I maintain this base? Have you seen an arch? People use for throwing arrow, a stick, and it's been tied at the two ends with a leather string, and then you can throw an arrow. You cannot use a straight stick to throw an arrow. So similarly, our foot is designed to help us walk, run, jump. And it is only possible if we have arches, if we have arc pattern within our foot. If we don't have arc, we cannot perform, and that's why those of us who are born with this problem, or who are born normally but later part they lost their arches, they are not taken, not inducted in armed forces. Because those who work in armed forces, their prime job is running, jumping, and doing this kind of business. They are not sitting in their air-conditioned offices. They have to be on the go and all the uneven surfaces. They have to jump, climb, and run. So, rule number 1, if you are applying for any Armed Forces Institute, they check on your foot. If you are flat-footed, you are not fit to be taken as a soldier or any high rank of soldier. Are we clear? So arches are a must, and those of us who don't have arches, if they walk for a short, they become tired if you compare with someone who has normal arches. Medial arch is more profound as compared to the lateral arch. So let's see how we can make an arch. So there is a base, and this is an arch. How I am maintaining the two ends? Why it does not go flat? Because this base, it keeps these two ends tied up with this. If we remove this base, it will go flat and it will collapse. And this thing, this black structure, we call it tie beam. So we bring wedge space stones. So our tarsal bones are like a wedge. I hope everybody knows what is a wedge. If you are in doubt, go any store, and when you are selecting the potato chips, just hunt for wedges and see how they are. Even you are eating pizza, they don't give you a flat thing, a rectangular thing, a square thing. You are getting wedges. Why you are getting wedges? Jawad. Why they serve wedges?
Because it's tastier.
Excuse me. If they serve you flat, the taste is lost somewhere. And why the cake you eat, you purchase, it's in wedges.
And it's distribution. Perhaps.
It's all about common sense. No science. Guys, these are the things supposed to be eaten by your hand, not by any device. So if you take a white thing, can it goes in your mouth? So it starts from a narrow and goes wider and wider and wider. Use it.
So if you buy some first, maybe we can.
Huh?
If you get some first, maybe we can think about it.
Okay, I'll get you. Don't worry. So we have so many wedge-shaped stones. The tarsal bones, they are together. How they are maintained? Fawad, don't tease him. Otherwise, I'll make a foo-foo story right now. This is his pet name. So this is where I have my body weight. This is my keystone. If this keystone is kicked out, this whole arch will collapse. That's a rule. Every arch, there is one keystone. You remove it, you'll see it's going down. And then, how these stones are connected, how these bones are connected. They are interconnected with each other. What are these? Staples. Do we have staples in our body? Okay, we don't have staples, agree. Don't we have ligaments? So ligaments act as staples. Right? Then this red guy, this is the main tie beam. And who makes this main tie beam? We have plantar aponeurosis, we have plantar muscles, we have short and long ligaments. They all contribute to this guy called tie beam. Before I proceed, I like to mention, in giving a support to an arch, we have active forces and we have passive forces. The passive forces are in the format of tie beam. All kind of examples of tie beam fall into the category of passive factors or forces. And the active or dynamic factors, they are the long tendon of muscles. Are we clear so far? So now the tie beam, and what are the example of tie beam? I have given you all the details. Long and short plantar ligaments, plantar aponeurosis, and plantar muscles. There are many. And this is my dynamic support. I'm sure in Riyadh you must have visited Wadi Hanifa. Have you seen there is a bridge? So these are the dynamic supports. And what are these purple or bluish things? These are the long tendons which are coming from our leg and to be attached to different parts of the bones of the foot. Are we clear?
Yes.
What are you doing? Some secretary job? Pay attention here. Otherwise, go chill outside for attendance and come in. I don't care. Right? So we call them suspensory supports. Now, when you look at a human foot, the body weight is being transmitted, is being represented by this black arrow. When it comes on the foot, it's been divided in 3 factors: backwards, 2 forward. And can you see these 2 blue things? A short one on the lateral side, a little high up on the medial side. So these are 2 plantar arches. Are we clear? And this is how our foot maintains the pattern of arching. So now you are looking at a tracing of a human foot. So this image reflects who has a normal foot and who has missing arches. Are we clear? Now let's look at bones of the foot from lateral view. And I'm sure everybody knows the names. And this red line is representing what? The lateral longitudinal arch. We have 2 longitudinal arch and 1 transverse arch. So this is one of the longitudinal arch, and you are looking at laterally. Why I'm saying laterally? Because you are looking at the 5th digit here. And this is my calcaneum. So let's paint how much, guys, before I proceed in this business, if I have more stones and I have less stones and I am trying to make an arch with less number of stones, what will be the height of my arch? The stone of same size. And so if I have less stones, can you wake him up? Ella, are you doing a night duty somewhere? In real season, controlling traffic? Pay attention. Otherwise, go, you're totally knocked down, go have some coffee. So, less number of stones, a lower arch. More number of stone, a higher arch. Are you clear? I'm asking you. Yes. Vade? So, we are utilizing part of calcaneus. What is this bone? Cuboid. We are looking laterally. Cuboid is here. And I have two metatarsals, fifth and fourth. Fourth and fifth metatarsals. And now you can see here at the calcaneum, and these are in the front, the heads of these two. Primarily, these are the structures which are in contact with the surface. If you are looking at the lateral longitudinal arch, are we clear?
Yes.
Now we are looking at medial longitudinal arch, and let's paint the bones here. Calcaneum again participating. Talus, that is a keystone on both the sides. Navicular and three cuneiforms. Medial, intermediate, and lateral. And three metatarsals. 1, 2, and 3. So this is, we have this many bones for the medial arch. So according to our initial understanding, we have more stones, our arch will be higher. We have less stones, our arch will be lower. Are we clear? Now I'm showing you an X-ray in this location. And what are you looking at in this X-ray? Calcaneus, talus, and what is this bone? Navicular. So, what should we call it?
Medial arch.
They are making a joint. This is ball and socket type of joint. Who's the ball?
Calcaneus.
No. The talus is the ball, and partially navicular and partially calcaneus. They are making the socket. And what is the name of this joint? Talocalcaneonavicular joint. Guys, this is one of the most important joint in maintaining medial longitudinal arch. If this joint collapse, a big part of my medial longitudinal arch will collapse. Think, if it goes backwards, it goes forward, then this guy will sink down. So the height will be destroyed in this portion. So this joint is very important, talocalcaneonavicular joint. Are we clear?
Yes.
Now we are looking at transverse arch, and it is existing where? At the bases of metatarsals. We have one transverse arch, we have two longitudinal arches. So let's review back. What is this bone? Tibia. Malleolus of tibia, talus, calcaneum. There's a bony projection. It has a name, sustendiculum tali. This will act as a pulley bridge. It's a very useful structure we have. And what is this bone? Navicular. And then we have three cuneiforms. And this is my first metatarsal. And now there is a ligament here. This ligament is placed medially. What is the name of this?
Deltoid ligament.
Deltoid. And now this deltoid ligament has various components. What are its components? It's not one. What is this guy? Between tibia and talus.
Posterior tibia.
So posterior tibial. Who is this?
Tibia calcaneus.
Tibia calcaneal ligament. And this slip connects the tibia with navicular, tibio navicular, and this one anterior tibiotalar. So these four guys, they are the one who makes deltoid ligament. It's not one structure. Father? So this is my medial longitudinal arch. This is the keystone. Someone asks you, what is the keystone in medial longitudinal arch? Talus is the name. So now, what are its supports? We already decided we have active supports and passive supports. So this is a ligament here. What is this ligament? Spring ligament. Guys, if this spring ligament collapses, this arch will fall. A very important ligament. A very important ligament. This is one of the maintaining factor between this talocalcaneonavicular joint. You remember the previous slide had an X-ray? So spring ligament is a key guy here. So it has another name. Sometimes people like to deceive you. They don't use the word spring ligament. They ask you plantar calcaneonavicular ligament. Who's the main responsible guy for maintenance of this talocalcaneonavicular joint? Spring ligament is one answer. But if I change this word into another, don't get confused. What is this? So this is a component of tie beam. Tie beam means a passive support. There is another ligament, short plantar ligament. It has also another name, so don't miss these another names. This is also a component of tie beam. If that was short, this ligament, the dark green, is long plantar ligament. That is also a tie beam. Then what is this? Plantar aponeurosis. And these are my plantaris muscles or plantar muscles. So these all are the example of tie beam. Guys, this plantar aponeurosis, it get inflamed. A lot of people. And then this plantar, we call it plantar fasciitis. It's one of the painful condition, and the person who's affected with this problem cannot walk. And I know a lot of our faculty people are suffering. Have you noticed why everyone is wearing sneakers? Why they're not wearing the classic shoes? Very few you'll see wearing classical shoes. Otherwise, everyone is in the sneakers. The reason, this provides another, because long working hours, your foot needs support. And if you are wearing classical shoes, then if you have a limited meeting or some show, then you can wear other way. So now, this guy, who is this? Coming from the back of my leg and getting attached, going towards navicular. This is
Tibialis longus.
tibialis posterior muscle. Right? This is number. And then I have another guy here. He's pulling it up. So now we are looking at, who is this? Flexor hallucis longus. This is one factor. Tibialis posterior, another factor. And then we also have contribution from tibialis anterior. This is coming anteriorly, these two are coming posteriorly, and these were the example of dynamic support or suspensory supports. Guys, you remember I talked about this sustentaculum tali? So this flexor hallucis longus tendon, it goes underneath and it also goes behind this talus. So they act like a pulley, and this is how it can be maintaining actively this medial longitudinal arch. So what are the factors? What are the dynamic factors who are responsible to maintain medial longitudinal arch? I can say tibialis anterior, tibialis posterior, and flexor hallucis longus. These are the three main principal supports for maintaining medial longitudinal arch. Are we clear? Don't make a mistake. Now we are looking at the foot laterally. Laterally, we all know there is no tibia, there is fibula, and there is the malleolus of fibula. Calcaneus, talus, just a sinus. This one is cuboid. My fifth metatarsal, and there is a ligament which is going forward from fibula to talus. Anterior talofibular ligament. Backwards, posterior talofibular ligament. Going downwards, calcaneofibular ligament. Altogether, we have a name for it: lateral collateral ligament. Guys, if you're calling it lateral collateral, then you call the deltoid ligament as medial collateral. It makes no difference. These are the different, this pattern, lateral and medial collateral ligaments, you'll find at ankle, you'll find at knee, you'll find at elbow, you'll find at your digits. So these two collateral ligaments are existing at so many locations. Either you name them according to the bones articulating, or you can just tell them, I'm telling you exam condition. You forgot what to write. If you only remember this is coming laterally, just write lateral collateral. Nobody will cut your marks. Okay, you will not get 100%, but you will be able to get something. It's a survival technique. Use it. And there is another guy, two of them, anterior and posterior talofibular ligaments. This is my medial longitudinal arch. So keystone again for the both of the arches was the talus. Lateral longitudinal arch is not that big. Okay, what is the job of lateral and what is the job of medial? Who will tell me? The sleepy guy.
What?
No, you are not sleeping. He's sleeping.
I'm sleeping.
No, you are not. He's sleeping. And why I'm asking him? I want him to wake up.
Oh, okay.
So he used his neurons. You want to say it? La 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 la. This is not the job here. The guy on the iPad, Allah. What is the answer? Now he will say what is the question. You don't know. Can you tell us? The guy with voice cancelling on, everything is on. Are you with this class? Doesn't look like. Anyone else?
One of them is for balancing or not balance?
Doctor, I just have a general question about the arch.
Huh?
I just have a general question about the arch.
Answer my question. You raise your hand. You are lost in time, space, and person.
Yusuf said that the arch in general is for running, so I'm assuming the medial one, which is more arched, is more specifically for running, and the lateral one maybe for
Sleeping.
additional or another function.
Medial for jumping, and lateral for landing. Lateral is more stout, more sturdy, and the medial is more up. So it helps us to push up. So for pushing up, the medial is working. For landing, the lateral is working. Anyways, so now these are the active supports, the passive supports, long and short, plantar aponeurosis, plantar muscles, all of them are tie beams. Now this guy, can you look at it? He comes all the way from the lateral side, crosses everything, under the sole of the foot and goes to the fifth base of the fifth metatarsal. So it gives a complete arch, fibularis longus. And on the other side, what muscle is at its counterpart?
Tibialis posterior.
longus.
Tibialis anterior. So tibialis anterior, tibialis fibularis longus. They make a complete arch, a transverse arch under the whole foot. From the lateral side, fibularis longus. From the medial side, tibialis anterior. They almost join with each other, and they are the one who are lifting our foot upwards, and they are running transversely. Allah.
Doctor, you said the lateral ligaments are more for landing, so are they a more common site of injury?
Gentlemen, when I said lateral collateral, I said lateral longitudinal arch for landing, medial longitudinal arch for jumping. So this is the word of mouth. I said something, and this is natural. Nothing wrong. I said something, you perceive something, you will tell something, and at the end of the day, it has a name, Chinese whisper, or what is the name for this? Like if you tell something to the person next to you, and when it reads to the last person, the whole biomechanics will be changed. Anyway, are we good so far? So these are the passive supports. Now the active support, we have this fibularis longus tendon, and then fibularis brevis tendon. Are we good? So these are the two dynamic supports for my lateral longitudinal arch. Clear to everyone? Now this is another view. You just look at it. This is how you can see the tendon of fibularis longus. It goes, cross everything, goes to get attached onto the medial cuneiform and first metatarsal. And if you remember, on the medial cuneiform, we have the distal attachment of tibialis anterior. Are we clear? So I just summarize it. So what is this foot? Normal or abnormal?
Normal.
Normal.
You have to see this medial longitudinal arch. And what about this guy?
Abnormal.
Guys, there is another name for this flat foot, pes planus. I saw some MCQ books, they use this word pes planus, and everybody got confused. If you see somewhere written pes planus, it means flat foot. No rocket science is here. Are we clear? And we also use fallen arch. Again, it's another word for flat foot.
So could the presence of sesamoid, extra sesamoid bones,
Hmm.
could it also form abnormally, for example, arched foot?
The word sesamoid means a bone which is formed because of a friction. Wheresoever in our body we have a lot of frictions, they tend to be formed, and we have so many sesamoids. We are born with patella, but the others are reborn according to need and usage. Am I able to answer your question? Are we clear, guys? So we know this. Plantar fasciitis, I have already, yes,
For the flat foot, which component of the arch is missing?
primarily medial.
Yeah.
Laterally, medial is the main guy. If think medial is gone, lateral must have gone.
Yeah, what's gone in the arch? Like, is it the support? Is it the bones? Or
See, primarily the dynamic supports. Primarily the dynamic supports. But if you lost all those active, someone is born with, and someone will progressively getting it. Maybe increase weight, lifestyle, this and that. So there is a gradual loss.
Doctor, you said that the arch itself is formed by the bones, right? And then we have the tie beam over here.
Arch is made by the stones, means bones, and it is supported by passive and active elements. These passive elements are small ligaments, fascia and all this stuff, and the active or dynamic supports are the long tendons which are coming from your calf muscles, anterior or posterior.
So like the tie beam itself, is it flat or is it also arched?
Oh.
Because we visibly see an arch, right?
Yeah, you can see an arch.
But the bones are like inside the body.
Yeah.
So you wouldn't see the arch bone inside.
Yeah, if I take off your shoes and I can demonstrate to the whole class. You want that to? I can do it for you, I have no problem. So today when you go home, if you have any sibling with you, just look his or her foot or put in front of a mirror and see how your foot is made. So guys, plantar fasciitis, we talked about it. It is basically a very serious condition. I don't want to name people, but I remember them. One of them was not able to walk properly for 2 years. One of our faculty colleague. And others are many. And if you see anybody start using suddenly sneakers, don't ask a question, understand why and what is the problem. Anyway, how we can avoid it, or how we can get relief to these people. Someone was asking me through an email, you mentioned some treatments. Mostly I mentioned some, it's not you. Someone, so it doesn't mean that every treatment which I mentioned, you need to memorize it. You're not here for phase 2 or 3 students, so primary thing you should be knowing. So how we can get relief, because plantar fasciitis is a very common condition. So analgesics and all that, rest, then physio treatment, and then orthotics and exercise, so all this works, but failure is quite high. Any question for plantar fasciitis? Now bunion, have you seen unusual bending? Ingrowing toenail, very common. Guys, this is something we can avoid. You know, when we have to treat our foot by ourselves or by someone, then we want to have well curved cut nails. Don't do it. You cut the nail, when it grows, it starts going inside your skin, and it will cause ingrowing toenail, and then you need to sacrifice this nail. That is the outcome. Otherwise, there is a pus formation, there is a lot of things. So don't make a beautiful looking, especially the big toes. Let it go straight. This is a very important topic for today. Those who are diabetics. We all know there are different people in our circle, they are diabetics. What is one single advice for them? Take care of your foot as much you are taking care of your face. Nothing more I want to say. Otherwise, you'll see someone will be end result amputation of the foot. Yes, from digits to whole foot, because diabetics, they have very poor healing power, and once they have wound, and especially diabetics, you know, most of the people here in Arabic culture, in the home, they are walking barefoot. They should not. You can have some home slipper, wear it. So if you don't do it, you have consequences. And consequences are not less or rare, they are quite grave. Someone will lose his digits, someone will lose his own foot. Are we good? So that concludes our learning for this topic.